So our next presentation, it'll be hard to top those two, that's for sure. But the chair will present on behalf of Mayor Turner to Director Stephen Williams and Chief Medical Officer Dr. David Purse to recognize the Houston Health Department's reaccreditation. Whereas when the first cases of COVID-19 were identified in Houston in March 2020, the Houston Health Department was ready to respond quickly, efficiently.
So they can hear me.
Yeah.
Okay, can you hear me now? So I'll repeat myself. So whereas the first cases of COVID-19 were identified in Houston in March 2020, Houston Health Department was ready to respond quickly, efficiently, and decisively to save lives. And whereas the department was guided by its access and equity response strategy to reach the city's most vulnerable communities to educate, test, and vaccinate Houstonians. And whereas the Houston Health Department's ongoing tireless work from every level and division continues to help prevent Houston from experiencing the level of tragedy that occurred in some other major cities. And despite the strain of the pandemic response on resources, the Houston Health Department remained committed to the comprehensive and exhaustive reaccreditation process from the Public Health Accreditation Board, PHAB. And on September 14th, 2021, the Houston Health Department Day will be observed in the city of Houston in recognition of the department's recent reaccreditation from the Public Health Accreditation Board during its response to COVID-19. Whereas the Houston Health Department maintained the standards, performance, and innovation required to be recognized as one of the leading health departments in the country by earning another 5 years of Public Health Accreditation Board accreditation, first achieved by the department in the year 2014. So therefore I, Mayor Pro-Tem Dave Martin, on behalf of Sylvester Turner, Mayor of the City of Houston, hereby proclaim September 14th, 2021 as Houston Health Department Day. Congratulations, gentlemen.
Well, thank you, Mayor Pro-Tem. We really appreciate your acknowledging the work of the staff of the Houston Health Department. As the proclamation states, for the last year and a half, we've been actually battling COVID, but I can tell you that one of my private and personal goals was to ensure that we were reaccredited, and I also wanted to ensure that we got a special Medicaid provider type for public health, and we were able to do that. Something that is probably not public is that although COVID was going on, we continued our regular services to a certain degree. And in some cases, we were able to actually see more clients than we did during regular service. For example, in our area agency on aging, we certainly delivered more meals and saw more clients. We continued our reentry program. Our Nurse Family Partnership Program actually saw more clients than it normally did, just thanks to the technology that was used. I'm really grateful for the staff that are willing to follow me. I should say most of the time, because sometimes they push back on me. And with me, I have to acknowledge the work. To my right is Dr. Melissa Shelton. She's our accreditation coordinator, because accreditation requires the work of most of the employees within the health department. My chief of staff and deputy director, Judy Harris, is on my left, and I have my new deputy director of public health with me, Dr. Shannon Bivens, who's to my right, my assistant, Randy Presley, and Scott, who all of you know as our communications person. David Purse, my partner in crime for the last 17 and a half years, is not present. He's out of town, and I will be getting him back for abandoning me during a storm, but I guess I'll have to forgive him because he does need that rest. But I'm really proud of the staff because they're willing to work no matter what the challenge is, no matter what the cause is. As of last night, even though we continued our COVID vaccinations and testing, my staff left our sites at about 7 o'clock. The staff here were preparing for a worst case scenario here in this office at this table. And I'm glad we were able to escape that major disaster with this tropical storm. So we really appreciate the acknowledgement. I also want to commit to you and the rest of the council that we will continue our COVID work. It is not over. We haven't reached that 75 to 80% of the folks that need to be vaccinated. It is slow going. Sometimes it is discouraging to staff because of the challenge, but we will continue until we reach that goal, because we too want to go back to what will be a new normal.
And thank you, Director Williams, and thank you, Director Williams, as well as your staff that's joining you today. And for Dr. Peirce, I hope he's enjoying some much-needed time off, because you and your team and Dr. Peirce do a tremendous job day in, day out.